This is Tristan Cray. This is April 2020. I'm doing my midterm competency retake, and I'm just walking into the room. I'm gonna wash my hands, then I'm gonna go talk to the patient. All right, good morning.
Morning.
So my name's Tristan Cray. I'm a student of physical therapy assistantship at Kennebec Valley Community College. And I'm going to be doing some physical therapy today with you. How does that sound?
Great.
Excellent. Okay. So before we get started, can I get you to verify your full name and date of birth?
Amy Louise Birkin, May 24th, 1982.
Excellent. We've got the right patient. Perfect. And I see that you're 13 weeks out from your supraspinatus tear, and it's your right shoulder. How is it feeling right now?
Kind of sore.
Yeah, I could see. The wound is healing up nice. I could barely see it. I see no redness, no signs of swelling or infection.
Yeah.
On a scale of 0 to 10, with 0 being no pain and 10 being extreme pain, what would you say your pain level is today in that shoulder?
About a 5.
A 5, okay. Alright. Alright, do you remember what the date is today?
May 21st?
No,
April 21st.
April 21st, exactly. Who's the president now? Do you?
Jimmy Carter.
Jimmy Carter, exactly. Yep. So, excellent. And I'm just going to ask you a couple questions first, just to make sure there's no reason why we can't do this. Have you had any fractures recently, bone fractures or muscle tears in that area?
I don't think so.
Okay, excellent. And have you had any deep vein thrombosis?
What's that?
It's a clogged artery, basically. You would know it if you had it. It's
Okay,
very
well then
serious.
I guess I didn't have it.
Okay. And you haven't had any myocardial infarctions or heart attacks recently, have you?
No heart attacks. What's
Okay.
the other thing?
It's a heart attack.
Okay. No heart attacks.
And alright, you don't have any malignant tumors or cancers.
Not that I know of.
Okay, excellent. So, I'm going to check in with the PT, and then I'll be back in 1 second, and we'll get the physical therapy on.
Alright.
So, just checking in, I have patient Amy Bergen, 13 weeks post surgery. She has no contraindications. She's very mentally aware. Seems like we are good to proceed. Thank you. So, if you want to follow me, we're going to go. We have the physical therapy plinth here. So, if you wouldn't mind sitting down, lying down on your back, your head will be up here, your feet back there. Okay, so first of all, I'm going to take some goniometric measurements. So we're going to actually take this. I'll give you a pillow here.
Oh, thank you. You're a very thoughtful PTA.
And this is going to go under your arm so you get a better natural angle when we measure the internal and external rotation. Okay, actually like that, yes. Okay, so first I'm going to measure abduction. So you can bring your arm all excellent. And actually I'm going to bring it down again, palpating the acromion right there. Fulcrum on the acromion, lateral to the sternum. This is going to the olecranon process. And we've got 85 degrees.
Okay, cool. What does that mean?
85 degrees of abduction is really good. You're improving.
Good.
Yep. And now we're going to do internal and external rotation. So we're going to move your hand down. Okay. And let me know at any point if any of this, if you feel a sharp stinging pain in any of these. And this arm's going to be pointing straight up. We got the olecranon, the ulnar styloid process. And 80 degrees. That's good. And now we'll go the other way, external rotation. Olecranon, ulnar styloid process. 90 degrees. Okay, excellent. Okay, so now we're going to move into the chairs and we'll get started with our exercises.
Okay.
You can take a seat right here. Right here, yeah. Okay, so before we start, we're gonna do a little bit of active assisted range of motion. So I'm going to be kind of guiding your limbs, but you're going to be doing most of the work. So you're going to want to kind of engage those muscles, and we're just going to go through the ranges of motion, and that way I can compare them to what we've measured and see how well your joints are moving.
Okay.
And so from all of this today, hopefully we'll see a little bit of reduction in pain, the pain of your joint. And will hopefully stimulate a little bit of healing. You might be a little tired and sore, just a tiny bit, but that's okay. That means we're working the muscles and you're improving your strength.
Switch chairs.
No, we can stay right here. I'm going to do your unaffected limb first. That way I have something to compare it to. So, there we go. So, remember, you want to do a little bit of the work. Excellent. And you want to bend your arm. And, oh, no, sorry. Now we're going to do internal and external rotation. So, actually, we can put your arm, there's two ways to do it, and this is one of them. Now we want to rotate downwards. Okay. Rotate upwards. Okay, and now let's see if you want to do your abduction again. Excellent. Okay, now we're going to go on this limb. We're going to go abduction. Okay. And now we're going to do internal rotation, external rotation. Good. So now I'm going to do a little bit of manual muscle testing. And so I'm going to use this chair. And actually, yeah, let's do it like this. And so you're going to put your arm at a bent position like this.
Which one?
We'll do your affected arm. And so what I'm going to do is I'm going to try to pull your hand to one side, and you're not going to let me move it, okay?
Okay.
So I'm going to try to pull your arm out, and you're going to try to pull your arm in.
Like this?
Yep, okay. Excellent, very good. This is just a test, just to see how much resistance you can give. It's not exactly an exercise. And also, when we're doing this, you want to make sure that you breathe. Breathing's very important. It'll be even more important later on. So now I'm going to try to pull your arm in. You want to push outwards. Okay. Excellent. Okay, you were compensating a little bit there. Do you want to try to keep your trunk straight and just move from the shoulder joint? Okay, ready? Okay, excellent. Yeah, you're improving a lot in the strength of these muscles.
Yay!
Okay. Okay, so now we're going to do some exercises. We've got pendulums. I know that you've probably been doing these since you started the physical therapy, but we're going to do those right now just to kind of loosen up the synovial fluid. That's the fluid in your joint. It's like the oil. If your joint is the motor, the synovial fluid's the oil. Gets it moving around, gets that joint nice and lubricated. So we're going to do 30 seconds of pendulums going forward, and we're going to do 30 seconds to the side. And with these, you want to remember that you're not moving your elbow, you're moving your body and just letting the elbow swing back and forth. And I know you're to the point now where you can do a lot more, but again, this is just a warm up till we can get to some harder exercises. So you want to stand up and do those pendulums?
Like that?
Yep. And then we're going to go to the side.
Do I just swing my arm?
You want to move your body.
No.
That'll allow your arm to move. So you want to give momentum to your arm. That'll allow your arm to swing freely.
So I'm just like swinging back and forth like that.
If you kind of unlock your hips and kind of move your hips back and forth, you could probably get some more momentum. Okay. Okay, you're doing both side to side, back and forth. That's great. We'll combine those into 1 minute of pendulums.
Mm-hmm.
Okay, that should be good. Now we'll move on to the next exercise. You feel okay?
Mm-hmm.
Okay, you're breathing well. That's great. I love to see that. Next exercise will be manual resistance. We're going to sit back down in the chair. And so the most important, from your reviewing your medical record, the most important thing that the PT really wants you to improve is the external rotation. That's this one where you're moving the arm out to the side, or in this case, you're moving your arm up. That's the one that's really going to allow you to dress much quicker, so you don't have to spend so much time dressing in the morning. Allow you to work, overhead, hammering and doing your carpentry that I know you do.
Mm-hmm.
So we're going to do manual resistance with external rotation. And so if you want to stick, again, we're going to go into that classic fist out.
Mm-hmm.
Yep. And actually, I'm going to go get that same towel.
Do I have to keep going like this?
Yes. Might as well. We'll continue our warm-up. Clutching your fist actually is a little bit of exercise. There we go. And remember, you want to breathe while you're doing this. We don't want any Valsalva maneuver. No. Yep. And breathe. Like you're a pro athlete working out. Okay. So, we're gonna do 3 sets of 8 seconds each, and I'm going to try to press in, but you're gonna press against me, right? Exactly, just like we did with the. Well, don't start yet. Sorry, just like we did with the manual muscle testing. Now, so actually, I'm gonna get on this side, and now you want to try to. We'll start now. Excellent. 1, 2. Remember to breathe. 8. Okay, and relax. Okay. That feel okay?
Mm-hmm.
Excellent. And we'll do one more. Well, 2 more actually. And you can start whenever you're ready. And this time I want you to count because that way I know that you're breathing.
Okay.
So ready? Okay. Go whenever you're ready.
1, 2, 3, 4, 5, 6, 7, 8.
Excellent. One more. Oh, sorry. Yeah, we want to give a little bit of rest in between each of these.
No?
Okay, now you can go.
1, 2, 3, 4, 5, 6, 7, 8.
Okay, very good. You were using your body weight to move into it. That's okay, but in the future, when we do these physical therapy in the future, see if you can really just isolate the shoulder and just use that shoulder.
Okay.
And I'm going to give you some exercises in a little bit that'll help you do that. So, but that was good for now. So now we're going to do the lawnmower. Starting the lawnmower.
Vroom, vroom.
And I know that you've been given some resistance bands that are much bigger than this one, right?
Mm-hmm.
Okay, so I'm going to show you how to do external rotation, starting the lawnmower with this one. But the one you have at home, I know, will allow you to do the full range of motion, right? Which actually throws in some bringing your shoulder up, abduction. That'll strengthen everything and help you avoid that shoulder hiking that we want to avoid. Because that's very important.
Okay.
Because that could lead to lots of bad things like shoulder impingement.
But what if I do it by accident?
Well, we're gonna strengthen those muscles so that you don't have to. That you're far less likely to do that by accident. That's why you're here. Okay, so I'm gonna show you how to do this. So, just like you have a lawnmower at home, and just like pulling the cord to start a lawnmower, you're gonna go like that. Yep.
Okay, I got it, I think.
Yep. Okay, so we're gonna do 8 of these.
Do I need this?
Nope, you don't need that anymore. I'll take that. We're gonna do 8 of these, so you want to stand up. And yeah, you want to come over here and face the camera. Excellent. There you go. Let's put it under your foot just like I did. Oh, see, what you're doing there is you're pulling it straight up, which is another exercise and probably one that we will have you be doing at some point. But right now we're really focusing on external rotation. So what we want to do is, you want to stand straight and just pull up. Good. And if you can't go the whole way up, that's fine. Just do as much as you can. Excellent. Perfect. Oh. Yep. That's good. You're getting some shoulder flexion or elbow flexion in there too. So
Okay.
if you keep this arm straight down by your side, that'll actually here. If you want to, I'll show you one more time. I did not explain that correctly, so I apologize, and I'm gonna explain one more time. I'm sorry about that. So, what we want to do is we want to avoid using the biceps. That's fine if you want to do that for exercise. But what we're really trying to do here, and I know this will be easier once you get home and you have your much longer resistance band, but you want to have your arm kind of out, right? And you want to just...
Okay.
I'll give that to you.
What you mean, like this? It's
Yep,
kind of
like
out.
that,
That's out.
and you just want to move it like that. There we
Okay.
go. Okay, that's a little bit. Good. Okay. So I'm not actually going to give this one to you for you to do at home because I feel like we did not have the proper equipment for me to really show you properly here in here at the office. So we're gonna wait till next time. We're gonna try to get a longer TheraBand. That way we can really show you how the real proper external rotation start the lawnmower works. But that's good. Now you have an introduction, and it's good that we know now that we need different equipment.
Okay.
But it was a very good attempt. It was a very good attempt. But I do have some more exercises that I'm gonna give to you. So, remember internal rotation, external rotation. You can practice these at home in a door frame. So, internal rotation. You're pressing in, right? You're standing even with the door frame and pressing in. And you want to do that. Remember, you want to breathe while you do that. And do that for a count of 10 seconds. So
Okay. So
let's
just
try
like
that right
this.
now. Oh, no. Sorry. If you come around here, you can see I'm pressing in to the door frame. I'm not actually touching the door frame.
Oh, okay. Why the door frame?
Because, well, actually, you want to have that classic fist punch position that I showed you earlier, like this.
Mm-hmm.
So
That's
your this part of your arm is down by your side.
Mhm.
Here, can I take your arm and move it like that? And step forward a little bit. And now press into the door frame. Excellent. There you go. And I'll do a count of 10 seconds, but remember to breathe.
Mm-hmm.
Good. And we'll do, now we'll try external rotation. So if you come over here to this edge of the door frame, and and we're going to do the same thing, except now we're going to be pressing outwards, right? And
I don't understand.
just like you were, yeah. So I'll show you right here. You're going to be pressing out. So you're going to be going like this into the door frame. Perfect. You could take a little step closer so that you've got a nice 90-degree bend in your elbow. You can step towards the door a little bit. There you go. Yep. Don't be afraid to get right up in there in the door frame. That's real close. Okay, perfect. And this time I want you to count for me. We're going to do a count of 10, and remember to breathe.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Excellent, and we'll do one more of those because that's the one we're really focusing on is external rotation. So you want to do one more set of 10. That would be great.
Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Perfect. Okay. So, how do you feel? How does the whole shoulder feel right now?
It feels good. Can I put it down now?
Yes, you can.
Okay.
Yes. We're going to sit back down now. And I'm going to give you this.
Ooh. Can I keep it?
Yeah, sure. Okay, we've got your affected arm right here. So,
Should I hold on to it?
yep, you want to grab it. And you're going to grab it real strong like that. Yep, top. Perfect. Okay, so now what we're going to do is some stretching. So, remember, so first we'll get into that classic 90-degree pose, and I'll take this first so I can demonstrate. But, so for stretching, the important thing is you want to feel it right in the muscle belly, the meat of the muscle, right? So when we're doing external rotation, you're going to feel that right behind your scapula, because that's the muscles that do the external rotation.
That right,
Yep, right
okay.
there, yeah. You want to feel it in the muscle. You don't want to feel it like up here in the joint. You don't want to feel any pain up there. Remember, we're stretching the muscle, so you want to feel it in the muscle. Right in the meat of the muscle belly.
Okay.
And then when we're doing internal rotation, you're going to feel it also in that same spot, but this time it's going to be under the scapula. So again, you don't want to feel pain right here. You don't want to feel it here. And you want to make sure it's a muscle feel, that the muscle is what's stretching, and you're not getting any like pops from your ligaments or anything. That's what we don't want. As long as you feel it in the muscle, that's good.
Yeah.
So first we're going to do external rotation stretch, pushing it like that to the point where you feel it stretch, and we're just going to hold that. And we're going to do that for 15 seconds. We're going to do 4 of those. So, I'll give this to you.
So you just put it this way?
Yep, okay, yep. And you want to remember 90-degree bend in the arms.
Okay. Like that?
Here, can I take this for 1
Yeah.
second? So, arms down, and there you go. Now can you turn your palms? There we go. There we go. Perfect.
Okay, so I'm pressing that way?
Yes, until you feel the stretch, and then hold it there, and remember to breathe. I'll count the first one, and then you can count the
What
next
if I
one.
don't feel the stretch?
You'll feel it.
Okay.
You'll feel it right there. You just had surgery right there. You feel it.
Okay. Okay, yeah, I feel it.
And then you can relax, and we'll do a 5 seconds of relaxation.
Mm-hmm.
And then you want to pick it up again and stretch it again.
Now do I count?
Yep. Yeah.
1,
Now you can start counting. Yep.
2, 3, 4, 5, 6, 7, 8, 9, 10. 7, 8, 9, 10.
Okay, that's good. Yeah, good. Now that we're on our third attempt at the stretch, you can, if you feel that the muscle's elongating, you can go a little bit further this time. But remember, we don't want to bend at the torso. It's all in the shoulder, so we don't want to like lean over. Okay, and you can start whenever you're ready.
Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Excellent. And take one more rest. And you can do that last 10 seconds whenever you're ready.
Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Excellent.
Woohoo.
Okay. And just to be extra sure, I remember that we should be doing this for 1 minute. So I'm going to have us do one more rep. And that combined with all the demonstration time will make 1 minute. So if you want to do one more, that would be great.
Okay, starting now.
Yes.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Excellent. Okay, so now we're going to go the other way. This time you're going to be pulling with this hand, the good hand, and you're going to stretch that internal rotation all the way in until you feel it really stretch. You feel it there?
Mm-hmm.
Okay, good. So now we're going to do the same thing. This time we're going to be doing 4 sets of 15. Because that'll give us the minute that we really want.
Okay.
So, once again, you can start whenever you're ready. Count to 15 if you want.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Okay, great. And you can relax. You got 3 more of these to do.
Okay, start now. 1, 2,
Okay, that's good.
3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Great. And we have 2 more sets of these. We want that full minute of stretch.
Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Good. And remember, we'll take the full 5 seconds of rest this time.
1, 2, 3, 4, 5.
Okay.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Great. How does that feel? You feel that the stretch right in the muscle belly?
Yeah?
Okay, excellent. So, before we leave, then I'm going to take another set of goniometric measurements to see how much progress we made during our exercise and stretches. So we're going to go back to that same spot. I got my goniometer. Follow me. And I'll get you a pillow.
Thank you.
There you go. And we got okay. And now do you want to turn it back? $90. That's exactly what it was. And now we want to turn it down. $90 as well. So you improved in your internal rotation just from the intervention today.
Oh.
So that's great.
Yay.
So we'll head back to the main room and we'll talk a little bit about your home exercise program.
Okay.
So you've been taking care of your wound really well. You might want to remember to keep massaging it, though. That'll help it heal up all the way. Really release the tissues that are sort of like stuck in there, crystallized. It really helps the healing process to massage it. And you don't have any of your range of motion precautions anymore. But you probably will want to be careful whenever you're doing something behind your back, like the classic putting the wallet in your pants. Yeah, you just be careful, and if anything with that happens, let us know, and we'll reevaluate those muscles.
Yeah.
And remember, you want to try to avoid hiking your shoulder. So since your rotator cuff muscles were in a sling for so long, they're a little bit weaker. So when you're doing stuff up, you're bringing your arm up like that, your body's going to want to naturally rely on whatever's strongest. So since those muscles aren't very strong right now, they were in a sling, your body's probably going to hike up that shoulder and do this. But we want to avoid doing that because that can lead to a lot of impingement. Like I said earlier, that's not fun. And it's really hard to get rid of. So just main thing to remember is your home exercise program and avoiding your shoulder hiking. And I have some exercises for you.
Ooh.
Here's the cane. And you have a cane at home, I know. There's the cane stretch. I'm going to give that to you. Internal rotation in the door frame. Right, remember that's pressing in.
Oh, yeah, okay.
Okay, external rotation in the door frame. And starting the lawnmower. Which actually I'm not going to assign to you this time, but you got a little sneak peek of what we're going to do in the future.
Fancy.
So, after all that, on that same scale from 0 to 10, what would you say the pain is in your shoulder right now?
About a 3.
A 3? Well, that's a great improvement from a 5 to a 3.
Yeah.
Yeah, just a little movement and working that shoulder, like, really helps reduce pain. Okay, do you have any questions for me?
I don't think so.
Okay, well, then I will escort you out.
Thank you very much.
It was a pleasure working with you
was a
today,
pleasure
and
working with you,
I
too.
wish you a lot of luck with that home exercise program.
Thank you.
Okay, I'm going to wash my hands again and then check in with the PT. Okay, I had patient Amy Bergen, 13 weeks post-op, supraspinatus rotator cuff repair. She had no contraindications, so we did some goniometric testing. She had 85 degrees of abduction, 80 degrees of internal rotation, 90 degrees of external rotation. And then we did some range of motion. We did active assisted range of motion. And then she received a grade of 5 on both internal and external rotation. With the manual muscle testing portion. And then we did some exercises. We did 1 minute of pendulum. Which she could probably use a little bit more practice in. I educated her a lot on how the pendulum actually works, how you're transferring momentum from the body to the shoulder, but she could use a little bit more practice because she was a little rusty with it. Then we tried to do the starting the lawnmower exercise because I think that's a great exercise for incorporating external rotation with a little bit of abduction, and it's very functional, and it's actually a task that she does. She really likes to mow her lawn. So we did not continue with that though because the equipment that we had was too short. It did not really allow her to externally rotate. She was doing more elbow flexion using her elbow flexors or biceps more than she was external rotation. She has a much longer TheraBand at home, but we should wait until we have the correct equipment here to show her how to really do it before we assign that to her in her home exercise program. So then we did door frame internal and external rotations. We did 3 sets of 10 seconds each. And then we did cane stretches using a cane. And we did 1 minute of total stretching for internal and external rotation, and educated her a lot on how the stretch should feel and where the stretch should be felt. And I educated her a lot actually on the position of external rotation, because she was sort of confused about a lot of the movement. So I think after today she has a much better understanding of what the actual movement is that she's supposed to be exercising and stretching. And then we finished off the stretching with another goniometric measurement, and she also had 90 degrees of external rotation, which showed no difference, but she had 90 degrees of internal rotation, which was an improvement of 10 degrees from the measurement before the intervention. And then I educated her further about wound care for her incision, which is healing up nicely, and I educated her about shoulder hiking and how she wants to avoid that. All right, overall I think it was a great session. I wish we could have gotten into the lawnmower starting, but next time, and I think she will have a lot of progress. Thanks.